Assalamualaikum everyone. How are you all doing? So today, please, you can, I'm just here to talk about the 5-day revision session that we will be having from the 3rd of February, 4th of February, I'm sorry. So I wanted to talk about that, but if you have any questions, any queries regarding anything, you're most welcome to ask about it. So we are going to be having a 5-day session, revision session. We will be touching upon all the important topics. First thing that I want to make clear is before COVID, and maybe during COVID as well, post-COVID as well, there was a certain distribution of topics according to which the question paper was set. It's called as the blueprint, basically, and there was a percentage distribution. But now there's a lot of PLAB going on, so that percentage distribution is not followed in the same pattern that was followed before. So when I gave my exams in 21-22, there wasn't any epidemiology there. So that was a good news for me. And then followed papers that we had with other candidates. We had candidates from mid-exam expert sitting for the exam told us that they had more of neurology, like they had other topics as well, but they had more of neurology. The last November paper had just one question from respiration, one question from acid-base balance, and just one question from CVS. That's what I got the feedback from. And a lot of there was from gynae, a lot was there from peds. They had touched a lot of questions from peds. So this is something different because before that, they used to touch a lot on CVS, in which they would give you imperial MI, they would give you the treatment or the diagnosis, complications, SVT, VT, that was there. But now they've changed the pattern. Having said that, it's not necessary that you want to be getting them in your exams, but you have a chance of getting them. So the purpose of the revision is to go through all the topics and then eventually have a mock. What we mean by understanding the red flag questions is basically any question that you have a problem with, any questions that you're not able to understand, or how to go about with those questions. So sometimes it's a very clear-cut choice of options. Sometimes you have two very close by and you have to choose one of them. And at times you're really in a mess that you don't know which one to choose. So how to put down your strategies over those questions? That is one concern that I'll be dealing with. The other thing that is I plan to go about with CVS. How will you diagnose all the MIs? How will you diagnose that this is a complication of MI? How will you go about with AFib and flutter, SVT, VT, and how will you manage those? Okay, these are some of the things that I will be touching upon. Then we have genetics. Pedigree, especially pedigree, which I've got the questions that people are having problems with those. I will be touching upon the pedigrees, not touching upon, of course, going in depth with those. Then we have infectious disease, pulmonary, pneumonia, various types of pneumonia. Then epidemiology, a bit of epidemiology. Honestly speaking, personally, I even don't like epidemiology. And I go about with it, trying to avoid as much as I can, but hopefully with that, teaching you all, I will get my expertise on that as well, inshallah. So these are the things that I will be doing when we will be doing the 5-day revision. And in the end, I will be providing you with the mock. Maybe it is going to be posted beforehand, or we will just discuss those questions online. That is going to be at least 120 to 180 questions. And that all depends on you people, how quick you post the answers and how quick we can go about. And then, of course, and we can have questions. We will be having questions in the regular 4 days as well. So that if you have any questions anywhere that you're missing out, we can discuss them at the end. Okay, this is how we plan to go about with the 5-day revision. So you have any questions, I am ready to take them. We just do it 7 minutes. So Yes, any questions, please either open the chat, you can post it on the chat box, or you can open your mics and you can ask me any questions you have. Please go about asking me questions. Dr. Huda, Adi, Sadia, Dr. Somya, any questions, any queries that you have. Nobody has any questions? Oh yeah, sure, we can revise ABGs. No problem about that. Okay, we can revise ABGs. Okay, so Dr. Somya wants me to revise ABGs. So what is the normal values? Firstly, we will go about with that. And then we will go about with how do we do it? Okay. Firstly, the normal values for everything is given in the exam. So you do not have to memorize any of the normal values, either the ABGs or the blood counts or ever, anything like that. So you do not have to revise any ABG, normal values. Okay. Now, for the ABGs, if you see this, we have the normal pH here. Normal pH, that is 7.35 to 7.4. Then we have the respiratory component. The partial pressure of carbon dioxide is the respiratory component. Okay, so let me put it. This is the respiratory component. Then bicarb is the metabolic component. Then there is one thing called as the base excess. Base excess, again, it is the metabolic component. It is going to be more than 2 or less than 2. Okay, more than 2 will be alkaline and less than 2 be acidic. Okay, now when you have any question that you have to see about the metabolic acidosis, respiratory acidosis, or whatever, first thing, the foremost thing that we go about is with the pH. All right, if you have a pH somewhere between 7, not just 7.25. Okay, so when you see this pH, you just know that this is acidic. Okay, this is acidic. Now, the next thing that you need to know or find out is this respiratory or metabolic. So, for the respiratory part, we have to go about with partial pressure of carbon dioxide. So, if the partial pressure of carbon dioxide, if you see over here, is more than 6.0, then it is going to be the respiratory. All right. And if the metabolic bicarb is less than 22, then it is going to be metabolic acidosis. Okay. So if, for instance, the bicarb level, the partial pressure of carbon dioxide is, for example, 7 kPa. So this is going to be respiratory acidosis. Okay, this is going to be respiratory acidosis so far. But when we go for bicarb, we need to see if the bicarb is normal. So if it is, for example, somewhere between 22 to 26. So we have, for example, 24. This is a normal value. So this is respiratory acidosis without metabolic compensation. Okay, why? Because the bicarb is within the normal range. It is not more. Okay, it is not more than 26. If it was more than 26, so the bicarb is increasing its value or in the blood, so to buffer out the acidic effect of the high level of carbon dioxide. All right, for instance, for the same question, if we had the value of, for example, 30, so it would with metabolic compensation. Okay, then it would be with metabolic compensation. All right, now, for instance, we have another question. Oops, sorry. We have a pH of 7.56. Now, this is alkalotic. pH is alkalotic. Now, we need to find out, is this respiratory or metabolic? So again, for respiratory, we will go for carbon dioxide partial pressure, and metabolic, we will go for bicarb partial pressure, bicarb values. So for example, if the partial pressure of carbon dioxide is 4. All right. And bicarb value is somewhere again 22. Okay. So this is going to be respiratory alkalosis. Again, without metabolic compensation. Okay. But again, if we have this value, if we have bicarb value now, this is alkalotic, right? So the bicarb has to go down. So this would be with metabolic compensation. So bicarb is going down. So the alkalosis is finished. All right. Or comes towards normal, somewhere or the other. Now, next, so far, is it clear, Dr. Somya? Or anybody else has a question? Okay. Dr. Somya, any other like if you have any questions related to these, you can please post it in the chat box so that I can answer those as well. Because for me to find it out right now would be difficult. Now, for example, we have a pH again of 7.6. Now, this is again alkalotic. Okay. Then we go for partial pressure of carbon dioxide. And breathe. You join in late and you want me to repeat quickly. Now, pay attention to this right now. Okay. Just pay attention to this right now, and then I will repeat at the end. All right. Now, for example, the partial pressure of carbon dioxide is 5 and it's 30. Okay. So bicarb is 30. So when the bicarb is high, so it means it is metabolic alkalosis. And as the partial pressure of carbon dioxide is within the normal limits, so it is without respiratory, all right, without respiratory compensation. Now, again, if I increase this to 7 or maybe 6.5, because now the carbon dioxide is more than the normal, then it is with respiratory compensation. Okay. Mr. Fizan, could you tell me the timings for the course? I think it's going to be at 8:30 every day. All right. There is Mr. Fizan putting in the number for queries as well and the contact. So you can ask them. And I think they have posted as well. Just give me a second. Yes, it's a 5-day revision. And the timings are going to be the same, 8:30. 8:30, it is going to be according to Pakistan time. 9 o'clock. 9 o'clock would be Saudi time, and yeah. So 9 o'clock would be Saudi time. It is 3 p.m. GMT. Okay, and mostly it's going to be 2 hours. Just a 2 hours revision. So you need to be very much prepared with your questions, your queries, not just the question, like any topic that you need to be revised. Either you could send me the message beforehand so that I would just not waste time like right now, like just right now, Dr. Somya asked me about ABG. So that day as well, you people are prepared that yes, this is the topic that we need to take on, and this is the topic. This is the question that I have a problem with. You could either post me ahead or you could have those questions ready with you there. So, without wasting time, we will be going about. Otherwise, I will be doing my revision with you guys. Like I will start with cardiology. I'll go on to respiration. Again, I will have some questions for ABGs as well. So far, is it clear? So for Dr. Farid, let me put in again that we start with pH. When we have an ABG in front of us, we start with pH. The normal value is 7.35 and the 7.35 to 7.45. Anything less than 7.35, it is going to be acidosis. Anything more than 7.45, it is going to be alkalosis. Now, once we have the pH in front of us, now we need to find out, is this pH variability because of the metabolic reasons or the respiratory reasons? So for us, the respiratory reason is carbon dioxide. That is the partial pressure of carbon dioxide, because carbon dioxide is an acidic gas. All right. And For the metabolic bit, we look into the bicarb because it is, as it is, alkalotic. Okay. Base. This base axis also represents bicarb. Okay. You could have bicarbonate value or you could have base axis. So base axis more than 2 is alkaline and base axis less than 2 is acidic. All right. So once when we have this, we then look into the partial pressure of carbon dioxide or bicarbonate that's given there. And one more thing, again repeating it, normal values are always there. You don't need to revise them. Remember them, sorry. So then once when you have the partial pressure, the pH, for example, this one, now you know it's 7.6. Now 7.6 is an alkalotic pH, all right? Then when you have this pH, then you go into looking at where is this alkalotic pH coming from, either from the respiratory part or the metabolic part. So for respiratory, we look into carbon dioxide. Now carbon dioxide over here is more. So this is not going to be responsible for the alkalotic pH. So we look into bicarb. So bicarb is 30, which is more than 26 here. So it is going to be metabolic alkalosis with respiratory compensation because the partial pressure of carbon dioxide has increased to bring the pH back to normal. All right? To bring the pH back to normal. So for that reason, this is how we look into metabolic ABGs. Now, there's another way of doing the ABGs, which is known as the TikTok method. A bit easier one, but the thing is, what happens is in exam, you really do not have that much time, but let's do it right now. This is acid, normal, and this is base. Now, for example, if we take this question that's put in there, if the pH is 7.6, this is basic or alkalotic, so pH comes here. Then we see that partial pressure of carbon dioxide is 6.5, so this is acidic. So we put partial pressure of carbon dioxide here. Okay, it's acidic. Then the part is again alkalotic, that is 30 because the normal value is 26. So this is going to come here. All right. Now this goes straight here. So this is metabolic alkalosis, and because the partial pressure of carbon dioxide is towards the acidic side, so it is respiratory compensation, with respiratory compensation. Okay, any query? Have you all understood till now? Any query in this? Anything that you are not able to understand, please ask me. Okay, good, Dr. Somia. How about you, Dr. Fareed? Dr. Huda? Dr. Ali? Every one of you? Shall I give you a few questions? Or you have any questions? Okay. So you have any questions with you? I'm putting it here because so that you have this as well in front of you. Okay. Now my question is, can you give me the answer to it? Okay. Very good, Dr. Aksa. We have about 18, minus me and the host, we have about 16 participants at the moment. So I want more answers. Okay. No. Okay. Why metabolic acidosis? Dr. Somia, please. Please, not you. Sania, why respiratory? Why did you say respiratory? You can open your mic and discuss it with me. I have no issues with that. In fact, it would be good. Why are you calling it as respiratory? Now, if the partial pressure of carbon dioxide, metabolic compensation, I don't know why you're asking that question, but yes, it takes time. See, it takes time to bring back the pH to normal. Of course, it is going to take time. So it does take time to bring it to normal, but that's not what we have to do here. Okay. Now see for this question, Dr. Aksa, this is for you. For this question, okay. Now pH is 7.8 and partial pressure of carbon dioxide is 8. If the partial pressure of carbon dioxide is more, then the pH has to be done. It has to be vice versa. Okay. If you look over here, this over here, this is less. 7.35 is less than 7.45. So when the pH is less, it's going to be acidic. For that, pH to be respiratory acidic, the partial pressure of carbon dioxide has to go up. Okay? So here if you see, this is also up and this is also up. For respiratory acidosis, the pH has to be down and the partial pressure of carbon dioxide has to be up. Okay, so then this we are going to call as respiratory acidosis. But if we let's put it over here. Okay, let's put it up here. If we have metabolic acidosis, okay? In metabolic acidosis, now this is again the pH is going to be down and the bicarb is also going to be down. This is metabolic acidosis. But if we go for, I don't have space here. If we go for, okay, let's put it here. I wanted to give you here so that you can see it properly. When we have metabolic alkalosis, the pH and the bicarb, that's what we are talking about. So the pH is going to be high and so is the bicarb levels as well. They go together. The pH and the bicarb, they go together. Now, let's do respiratory acidosis and respiratory alkalosis. For respiratory part, we always look into the partial pressure of carbon dioxide. Okay. Now, for respiratory acidosis, the pH is going to be down, but the partial pressure of carbon dioxide is going to be high. It's going to go up. For respiratory alkalosis, the pH has to go up. Okay. And the partial pressure of carbon dioxide has to go down. Now, if you pay attention over here, if you see it, then it goes opposite to each other. Oops, sorry. It goes opposite to each other, and here again it goes opposite. But in the metabolic part, they go together. Okay? In the metabolic part, they go together. Okay? Now, any questions so far? Any questions? So, is it making sense to you all? Is it clear? Okay. What about other people? Rest of the 15 people. Okay. Now, let me give you a question. Okay. Now, let me give you a question. Okay. For example, we have a pH of 7.31. Partial pressure of carbon dioxide is 9.8. Okay, and then we have what is that? And okay, let's add a little more spice to it. I need an answer. I'm sure you got so excited that you put in with metabolic compensation, respiratory compensation. Okay. All right. Anybody else has a question, please? Anybody else has a question? Yes. Good. Now, basically what happens is that you are given the value of carbon dioxide, oxygen there in the exams. And why are you given the value of carbon dioxide there? Sorry, oxygen, partial pressure of oxygen. Why are we given the value of partial pressure of, why are we given the partial pressure for oxygen there in the exam? We are given partial pressure of oxygen to determine is it type 1 or type 2 respiratory failure. All right. Now, some places in the exams, you're not supposed to find out about the ABGs. You're supposed to find out that is it the partial pressure of carbon dioxide, how bad is it? So in case of a respiratory failure, there are two types, okay, type 1 and type 2 respiratory failure, where we look into the partial pressure of oxygen as well. So if for first thing is if the partial pressure of oxygen is abnormal. It's going to be abnormal in both the type. Let's put it here. Just put it here. Okay. Now we have respiratory failure. Okay. So we have two types, type 1 and type 2. Okay. In both these types, the partial pressure of oxygen is going to be low. Okay. Now remember, type 1. That's how I remembered. Type 1 has only one low. Has only one low. That is partial pressure of oxygen. And partial pressure of carbon dioxide is normal usually. Okay, that's what you're for exams. Okay. Or normal, or it can be low. Okay, but in type 2, again, there is going to be two values that are going to be low. That is the partial pressure. Sorry. There are going to be two values that you can look. Partial pressure of oxygen is going to be low, and the partial pressure of carbon dioxide is going to be high. Okay. Two values are abnormal in type 2. One value is abnormal in type 1. Okay. Making sense for everybody? Any questions? Any questions? This is important from exam point of view. Any questions? Any questions? Is it okay? You have any questions? Any questions regarding EBGs with you right now? Any questions? For example, you have a question. When I put in a question, let's just check another one. pH is 7.47. Okay. I'm giving the partial pressure of oxygen as well. Okay. The partial pressure of oxygen is basically normal value is between 10 to 14 kP. Okay. Just for the exam purpose, normal. Partial pressure of carbon dioxide is 7. 38. What it is. Good. Dr. Fareed, you made me revise the thing and you're not answering the questions. All right. I think you got the concept of it. Now, any other topic? So how is the revision going on? Everybody here is present here right now, is appearing in the Feb, or somebody is going to be appearing later on. I know about you, Dr. Huda, Dr. Soumya, Dr. Ali, Dr. Fareed, Dr. Farhan, I think as well. They all are appearing in Feb, but there are other people today. I haven't seen them before in the class. So I was thinking that maybe they will be coming for the next session. And so Anjali, Dr. Aksa, are you coming for the Feb or later on? Yeah, May. So do you plan to take the revision? I'm not prepared for epidemiology at the moment, honestly speaking. What is your query, by the way? Okay, Dr. Haris Durrani, you are taking OET with Dr. Karishma. Okay. So what is the topic that you need to do, Doctor? Which subjects, Dr. Epidemiology? Epidemiology is difficult? Yes, epidemiology is difficult. I agree. It's not difficult. It's not, basically, it's something that we haven't done. So that is the reason for us, epidemiology gets a little difficult. What is the problem that you're finding in epidemiology? The entire epidemiology, or there are certain things? Wait, I am going to stop sharing and see if I can have epidemiology right now. Geriatrics is very easy. It's very simple. It's just to read. It's nothing that has to be, I would say it's nothing that difficult in in geriatrics. Geriatrics, what you have to do is, what do we have in geriatrics? We have consent. We have consent. We see the mental status, mental capacity. How do we take care of the patient? That's all there, because that's something that we do not do in normal routine in our part of the world. So that is the reason why it is difficult. In geriatrics, you have the hospice care as well. See, in UK system, NHS, the caregiver comes to, by the government, comes to a patient at least maximum 4 times a day. So if that has to exceed 4 times a day, then they basically ask the patient to be shifted to the hospice care or the old age home, where they can be taken care of. As far as for the epidemiology is concerned, so yes, epidemiology is difficult. I'm trying to find that out right now, but it's okay. Let's see if I can do this right now with you. And VVG, Venice value with electrolyte imbalance and their causes. Causes could be COPD, asthma. You could have vomiting, diarrhea. Then you could have some congenital, like, for example, you can have in cystic fibrosis, as far as I remember, but I can't be very sure about that, Dr. Karishma. So those are the things. Wait, give me a second. This turn I didn't do epidemiology with the candidates. It's a bit raw for me at the moment. Now, see, in epidemiology, we have 2 types of studies. One is non-experimental, which we call it the observational, and the other one is experimental. That is called the randomized control trial. So what happens in non-experimental or observation? We do not do anything in those studies. Okay, we do not give them any kind of medication or nothing like that. So, but the other part, which is the experimental or randomized control trial, we select 2 groups of people, in which one group is given a medicine and the other group is given a placebo. For example, in experimental randomized control trial, in which we have 2 groups of people. The groups either could know each other or could not know each other. They're total separate groups. One is given a medication for example, diabetes, and the other is given a medication for, and the other group is just given the placebo. And then we see them on a longer period of time, maybe 2 years or 3 years, how those medicines are acting on them. How are they going about with those medicines? So that is a randomized control trial when there is a medicine is given to them. Randomized it is going to be picked up randomly in the public, from the population. They're going to be picked up. Now then we have the analytic, which is an observation. We have cross-sectional, we have case control, we have cohort. So what happened in cross-sectional? Basically, these are, again, observational studies. Cross-sectional, basically what happened is, if you have a timeline, for example, this is a timeline, and you just cross it in between. For example, this is somewhere in Feb. How many cases of such and such were there? You're just having it at this point of time. In Feb 2024, how many cases? For example, malaria were there. For example, something like asthma was there. Okay, so they had an exposure. These people had an exposure maybe of the mosquitoes or pollen. So what was it? You're just doing it, taking at the same time in the population, and you're just observing it. So that is a cross section, because you're taking it in a particular time. Okay. In this, we do compare diagnostic tests, check association between exercise and CHD. Like, for example, the patient who were exposed to had malaria. Now we were going to see how much of polluted that area was. Okay, or for the asthma people, how many people contracted asthma in a particular place at that time. Or for example, again, if these people have COPD, CHD, that is congestive heart diseases, how much cardiac heart diseases, congestive heart diseases, how much they were exercising. That's in particular point of time. That's it. That is about cross-sectional, for us. Okay. Then we come to case control and cohort. Now, case control, as the name itself says, it starts with cases. It starts with cases. Okay. It starts with cases. We have cases, for example, cases in a certain population. Okay, cases in which we have, for example, cases of lung disease. So we go back in time and compare them. If they see case control, it goes back in the past. Okay, and we see that retrospectively, what were they doing that time? Were they smokers? Were they non-smokers? And this is what they caused them to have this disease today here. So case control, we have cases and we have controls. We have two groups in there. And we see that what they were doing in the past. Okay, were they smokers? Were they exposed to some kind of thing that caused them maybe asbestos? Were they working in a shipwreck company, which caused them to have this lung cancer? Okay, so we go back. This case control is study, and we have a control of people who do not have lung cancer, and we go back and see what were they doing, what were they exposed to? Were they exposed to, for example, if you're taking cigarette smoking, were they smokers? Were they involved in any of these occupations like shipwrecking or asbestos, and so they didn't develop the disease? So that is how we do case and control. Now, when we come to cohort, we take the risk factor and we go forward with it. Cohort, and we see if those people, after taking in the smoke, for example, they're smokers, and if they go over like period of 2 or 3 years, will they develop that disease? So if anything is going forward, is prospective cohort. Cohort has two types as well. That is retrospective and prospective, but case control is always retrospective, goes behind. They start with a case and they go behind. Okay. Now then we have those randomized control trials. Participants in randomized control trials are basically they are randomly picked from the population, and then one is an experimental, the other one is a control group. Any new drug is taken. These are traits which introduce on treatment or exposure on an active group and compared with the control group, which has no exposure. Okay. Now this is single-blinded and double-blinded. Now single-blinded means that the participants or the researchers do not know about it, that in which group they are. The previous slide, Dr. Farhan, I'm having a lag. Okay, here. All right. Before that, this one. Okay. Can I go on further? I try to do it so that we are not disturbed in between. Just take a clip right now. Then we have double-blinded. We have single-blinded. Means participants or researchers, not both, do not know which group the participant are in. So, for example, if I am a participant, I would not know if I am in the control group or exposed group, or exposure or non-exposure group. I wouldn't know. Or maybe the researcher would not know if this person is in the exposure group or the non-exposure group. Now, the double-blinded means that the participants and the researchers both do not know which group they are in. Okay, neither do I know, nor do the researcher know which group I am in. Okay, I am just taking in medications and they're just checking me out, not knowing where I am. I don't know if I'm in the exposed, if I'm taking a medicine or if I'm taking a placebo, and even the researchers don't know if I'm taking a medicine or I'm taking a placebo. That's about randomized control trial. Wherever in the question you are given that the intervention was done, medicine was given, so that is a randomized control trial. Now there is again case study or case series report of a unique or rare case. Okay, systemic review or compilant of all the articles in a particular topic, meta-analysis, mathematical analysis of result available from a published article on a particular topic. Cluster randomized control, similar to randomized control trial, with exception that the randomized involves clusters or groups. Okay, clusters of groups, like they are put into hospitals, or they do not know about, or schools or somewhere, rather than individuals. Okay, the schools are going through it. The same thing is case control. We start with case, we go back. It is retrospective. It is cheaper, and but it has a bias. Bias means people tend to forget things. Okay, it's designed to help determine if an exposure is associated with an outcome. The outcome of each subject is already known to the investigator. This is epidemiological. Now we have odds ratio. Using the rare disease assumption, both odds ratio and relative risk can be used to study association between exposure and outcome. However, odds ratio is preferred because the prevalence of the disease outcome is already known. Odds ratio that an outcome will occur given a particular exposure compared to the odds of outcome occurring in the absence of that exposure. Okay, so what is the main thing that you would want to do in epidemiology? You have to tell me that. I cannot go on the entire topic. So Dr. Aksa, is there anything else that you want to know about it? We have a lot of calculations. We can keep this for the revision sessions. Okay, we can keep this for the revision sessions. Please have your questions ready, have your topics ready for the revision, so that we're not wasting time. We're not going here and there, going about here and there. And if you can, just give me the questions before, or the topics before the session. So I think I would revise epidemiology as well, so that everybody can join in. Do we have forest plot analysis? Let me check. But I will go into it. I'll check into it. All right. So let's see you all there in the revision session. Please try to finish up all your questions so that it is easier to follow. Okay, it is easier to follow. We're not wasting time, making maximum use of all the 2 hours that we're going to get during the revision session. Okay, and all the best to you all for the preparations, and let's see you there. Any questions, let me know on the WhatsApp, please, or even on the Telegram. It's fine. You're welcome, Dr. Krishna. Thank you, everybody. Take care.